Good morning. I'm Dr. Steve Stites, Chief Medical Officer here at the University of Kansas Health System and Executive Vice Chancellor at the University of Kansas Medical Center. Welcome back to Open Mics with Dr. Stites. Can you believe that we've been doing some version of this program for 5 years? Okay, 5 years ago, I had hair, man. I had hair. I looked young. Back in March of 2020, Doc Hawk and I sat behind this same desk to update the news media about the COVID-19 pandemic. And yes, you're looking at some footage. We may have been sitting, oh look, see how much younger I looked in that footage? Holy cow, I was a completely different guy. But we were probably sitting a little close to each other. We didn't have masks on, did we, back then?
Yeah, but you know, again, I think the circulation of the virus at that point in time was much less significant than it is currently in our current
Not that
day.
we could have tested for it back in March of 2020
That's right.
to know if we were seeing it or not. But we were building that plane while we were flying it. And as soon as we learned something new about COVID, we would try and share with you, our viewers. We tried to do that in a way that was kind of an honest, straightforward explanation of what was happening. One of the things we said, we weren't going to flapjack. I love that turn of phrase. We're not going to flap our arms and jack with the truth. And you know what? That is still the case today. Yeah. We really work and take great strides to make sure that what we are saying accurately reflects the degree of knowledge that we have. We'll tell you what we don't know. We'll tell you what we do know. And today we're going to reflect on where we were then and where we are now. And it's always great to have Doc Hawk up here at the desk with me again today. Actually, that's a lot more fun because I can mess with him a little bit. Back when this started, his name was, I don't even know his real name, it's Dana Hawkinson.
Right.
And like on day one, it was like, yeah, you're Hawkeye.
Yep.
and that has stuck. That's stuck. All right. Also here is Stephen Hager, the chair of the Healthcare Coalition at the Mid-America Regional Council. We call that MARC for short. And that's a group that is vital in coordinating the efforts of the different cities and counties in the Kansas City metro area. And they did a great job. They're a great help to all of our region throughout COVID, but really every day. And they're one of those groups that operate a lot in the background. You don't know what they're doing, but if they weren't there, you would miss them and you would feel that. Stephen is also the Director of Corporate Emergency Management and Compliance at the University Health, and he is the Mayor of Platte City, Missouri. Welcome back, Steve Hager.
Thank you.
How are you?
I am well. Thank you for the opportunity.
Excellent. Well, welcome to the program. All right, first we're going to do morning rounds. We have a special guest today. Now, we say she's a guest. I think Chelsea Smith is like a regular on our program because during the pandemic and before and certainly after, Chelsea has been here to talk about the community blood bank, how things are going with their donation campaigns, and we just want to say, Chelsea, thanks for being here.
Oh, thanks so much for having me. That was a throwback shot you just had on the screen there.
Yeah, I was gonna say long hair, short hair. Didn't you start with long, go short?
Yeah, I had very short hair back then, so it's been a few years, hasn't it?
All right. So we've talked, you've been here before, you've talked about the need for donations, and during the shutdown, we still needed blood, and it was a lot harder to get when things were so shut down. Now, so let's just talk about how that kind of leads us up to our very special moment. One of our health system employees heard about the need for blood and began rolling up her sleeve. Congratulations are in order to Julie Graham. She works in coding, and this weekend she donated her 100th pint of blood, and her family was right there with her.
I work for healthcare. I know that people need blood. It's life-saving, and for me, it's hardly a sacrifice. 100 pints, that's 12 gallons out of my body. So I know we replenish it, and we can give every 56 days.
So Julia told us she always felt safe donating because everything is so clean and organized at the Community Blood Bank. Chelsea, let's talk about how things have changed since COVID and how are things going today? As I know we had a shortage a few weeks ago or a few months ago. Are we back in full swing now? Are things going better? Where are we?
Yeah, our inventory is a little bit low. It's lower than we'd like it to be, but we have had some weather that has impacted our ability to collect. You can't tell this week; it's wonderful out, but we, whenever we see winter storms like the winter that we just had, it really impacts the blood supply. So our blood drives are, for the most part, back in full swing, but we've still got some workplace blood drives that during the pandemic, a lot of workplaces went permanently remote. So A lot of folks, we don't get to go to those blood drives anymore. And then additionally, getting back into schools is a little bit slower than we'd like it to be. But for the most part, we are back in action and doing a lot better than we were in 2020, that's for sure.
Yeah, that's good, because I remember it was at some frightening low levels, and with hospitals packed full of sick patients, that was a challenge for you and for everybody. So who are your best donors?
That's a trick question. We love them all. All of our donors are the best donors. But I will say, the donors that come back, the donors that donate once and keep coming back and doing it again and again, like you saw with Julie, we need people to make it more of a habit. And if the reality of the situation is, if most people who are coming in our doors every single day make that next appointment to come back in 56 days, we're not having a blood shortage again. So just trying to make that more of a habit, I think, for people. And I would say our best donors are just those that come in and donate.
Well, you know, our team here is gonna kill me when I say this, but if we could ever do this sometime during the program, I'd be happy to donate a pint right here during open mics with Dr. Stites. We could do vampire rounds. I think that would be awesome. So
let's do it. Let's do it.
I'm all about that, and again, my team's about ready to kill me with that idea. But you know, that's what they love about me, the unpredictability.
Yep.
Okay. All right. Who do you want to see become even better donors?
You know, the share of blood donors under the age of 30 has really taken a hit in this, post-COVID world that we're living in. We saw a drop in donations from donors under 30 by about 50%. That's gigantic. And so for us looking forward, it poses sort of a long-term threat to the stability of our blood supply as people get older and age out of the donor pool, or they might go on medications that prevent them from being able to donate blood. It's incredibly important that the younger generations are replacing them. And unfortunately, we're not really seeing that right now. So I think there's a huge area opportunity for growth with that age group. Looking at you, Gen Z, we want you to come in and donate blood and make it a life-saving habit so that we don't have to worry about blood shortages in the future.
You know, we should really thank you, Chelsea. You have put so much time into this program, into the Community Blood Bank. I know you're really dedicated, so thank you for being on the program with us today. We're hoping, like you, I suspect, that those winter weather events are done and we won't have any more winter storm warnings or blizzards to contend with this year. And mostly, we just want to say thank you for all your great work and your support of the Community Blood Bank, because it makes a difference for all of us. So thank you.
Well, thank you for saying that. It's a pleasure.
All right. So the COVID-19 pandemic impacted everyone, not just here in the health system, although it was a pretty big impact when we had 250 COVID patients here on this hospital. We sent a camera out and about to ask people their biggest memories from the height of the pandemic. Let's see what they said.
It was scary, and I remember the stories about trucks, refrigerated trucks in New York City that were just loading up bodies.
There were no cars on the street. It was really weird. It was like one of those movies of the after nuclear war.
I was scared to death, and I stayed at home.
Everything shut down.
You're fighting for toilet paper and Lysol and hand sanitizer, and it felt uncertain.
Being a small business owner, it was freaky. I was freaked out.
I did get COVID. I didn't really feel like it was anything more than a little bit of a cold.
It definitely sucks, but it wasn't anything worse than strep throat.
I felt sick for a week or so, but never anything. I had to get hospitalized or anything.
I think it was really a bummer not to actually have a graduation, especially a master's program where you're supposed to have the hood is placed on you by your professor. So that was really disappointing.
I had a friend whose husband would come home and go through the garage, change his clothes in the garage, take a shower in the garage. I have another friend who is a traveling nurse, and when she would come home, she lived in a trailer in the driveway.
It pretty much ended my print brokering business because my emphasis was on trade shows. And trade shows shut down completely.
It really actually kind of messed me up. I stayed in and I started drinking a lot. I became kind of a wino. You
You know, we love being out of the committee talking with all of you on our favorite medical topics. And While chatting with people about COVID-19, we ran into Ricky Kidd. Ricky Kidd is an exoneree. He spent more than 23 years in prison for a murder he did not commit. He's been cleared and released from prison. Here's a photo from that release. He has his own take on COVID.
I remember being exonerated after 23 years, coming home August 2019, and 7.5 months later, going back into a form of lockdown, essentially. A colleague of ours, director of the Midwest Innocence Project, her and I had just was driving back from testifying before lawmakers, and we had heard on the radio that the state of Missouri in the city of Kansas City was going into lockdown. So that was our last time seeing each other for a very, very long time.
You know, Dr. Hawk, there are so many powerful memories from that time. And you and I certainly worked hard to try and keep people informed with our team here, who is marvelous. What memory stands out from the pandemic to you?
You know, I think it was, so personally and socially, certainly it was like what we saw one of the people on the street talking about is the streets were empty. And there were a lot of people out walking because otherwise you were cooped up inside. But the weather was nice like it is now. It was the springtime at that point. But there were no cars on the street. And you could go down to Westport of the Plaza and just be walking in the street because there were no cars. You know, otherwise, personally and professionally, I didn't really notice much of a change because we were lucky enough to be able to continue most of our daily routine of coming into work. Unfortunately, as the numbers ramped up on people who got COVID, just as you said, we had a huge impact in our daily census in those people that we could do nothing about, and we could not help them in those early days. So that was impactful on the professional level, but otherwise on the social level, it was the fact that, yes, it was so quiet on the streets, you could be out walking right down the middle of the street and there were no cars.
As we think about it, it's going to turn now to Mayor Hager and the community. What were the biggest challenges from your standpoint, getting local governments to get on the same page and dealing with the citizens in your town?
Yeah, that was a big challenge. Every local jurisdiction had the responsibility to set their own policy. Yeah. And, it came down to the public health departments and the elected officials to trying to decide what was best for their local community. And you always have to overlay the politics on that, right? So whether you're a more conservative community or not, played into what rules you thought were most important to enact. And so through Mid-America Regional Council and the Healthcare Coalition, we worked on putting together the Multi-Agency Coordination Center, which was where we were able to start bringing the experts together and share that information with the elected officials, the public health departments, and sort of outline what we knew at the time, but it was changing every day, right? So we had to make sure we were providing that most accurate information at the time to help them make the best decisions for our communities.
You know, what I think one of the things that strikes me the most was how hard people in communities here in Kansas City and other things worked, and how hard we were just to tell the truth as best we know it. What was most concerning to me was watching it get politicized across the country. And I don't think we should be politicizing health or healthcare or healthcare decision making, because that should not be a red state, blue state, because medical things like COVID or infection or heart disease or cancer, they don't care about red state, blue state. And so what we really need to do is together try to look at the facts as we best know them, and not be through an internet lens or through a histrionic lens. And so that's what I thought. That's what I remember most clearly in my mind. I was like, wow, this got really politicized. I was here and grew up during the HIV epidemic as a physician. And I thought, okay, that got a little too politicized then, but this was much worse. And I think it cost people lives because we didn't get people just to stop and listen to each other. And I don't just mean from COVID, but from all the side effects and shutdown and lockdown and schools, et cetera. I mean, if we had just had a better listening, a little less political, I'm not going to say that, a little less of a political slant in terms of how it became so polarized, I think we would have done better. I think the mayoral and the elected officials here in our region did a great job at listening, and I thought we worked really closely together with Mark, with our elected officials, with the Chamber of Commerce, with healthcare providers from all of our healthcare institutions around our area to really try and work together to come up with the best possible plans.
Well, that was the only option we had, right? So, you know, within MARC, we're 9 counties, we're 2 states, 119 jurisdictions. And so you had a lot of conflicting opportunities there, but, you know, being able to share that information, I can remember there were cities or counties that, you know, everyone had to close down by 9 o'clock. Or somebody else was 11 o'clock. Well, COVID didn't take a nap, you know, in one community and not the
exactly.
other. And, so, you know, trying to help standardize that so people had more consistency, and, you know, we were making the best decisions based on the science that was evolving, but still trying to put out that best information.
And, you know, the people now are like, oh, COVID's not bad. And it's really not anywhere near what it was. No. But back then, it really was bad. You know, we've never had an event, a medical event, where we had 250 of this. Out of 750 RN patients, a third of them were here because of COVID. Had they not had COVID, they wouldn't have been here. And so that's a lot. I mean, we don't have a third of our beds hanging out here waiting for a pandemic. So when that happens, there are other patients who get displaced and can't get care. And then we force our paramedics and our EMTs into some pretty difficult situations. Talk to us a little bit about what it was like for EMTs and paramedics from your standpoint as a mayor.
Right. Well, in my background, you know, I've been in EMS for 35 years, so that
really
that is
it's
my
not
background.
A fair question. What did you think about it as a president?
Right, but I haven't worked in the field for 15 years. But I've reached out to friends who are still doing that job and said, you know, what was it like? What were you experiencing? And, you know, it was consistent for them as everywhere else, but, you know, about a third of their workforce was out any given day. So they had, you know, less ambulances on the street to respond. And then early on, you know, they're wearing the high isolation gear, so they're always wearing bunny suits. Well, they were never doing that before. You know, it was almost more of a joke to get a EMT or paramedic student to put the suit on because they thought it was necessary. But that really wasn't how they would typically practice. They had policies where they would try not to go into somebody's house or place of business. If at all possible, they asked the person to come out to them. So, you know, they were changing the way they were practicing. If they had a patient who needed medication, so if somebody was having an asthma attack or difficulty breathing and they needed to give them albuterol, well, that's an aerosolizing procedure. And instead of doing that in the back of an ambulance, that's pretty much a Petri box because they can't maintain good air circulation and all of that. So they would try and do those procedures outside of the ambulance, outside of the house. And now you're doing this, you know, again, everyone's sitting at home because they can't go into work. So you're providing patient care to an audience, and you're not doing it in the back of your ambulance on the way to the hospital where they can get definitive care. So that was a big challenge for them. You know, they had line of duty deaths. And so, you know, they're going through and experiencing, we're losing our coworkers because of COVID, and yeah, we have to go into work every day. And so, you know, there was a lot of PTSD around that, and they're still recovering from that today, like all of us are. But, you know, EMS, like any other branch of healthcare, it was significant impact, and we felt the same things in the hospitals.
Yeah, we really did, and we watched the patients die here. I think especially our ICU nurses, especially in the medical ICU areas, were pretty traumatized by this because there are so many deaths from it. Hawkeye, we kept saying throughout the pandemic that we were building airplanes, we were flying it. Name one thing that stands out for you the most about how you practice medicine post-COVID, and what did it affect?
You know, I think the basics of my day-to-day, I'm still wearing a mask when I see patients in the hospital. It's for my protection, it's for the patient's protection, especially during respiratory season. Most of my ID colleagues are still doing that, even though we haven't had a mask regulation or mandate in the health system in the hospital for quite some time. So that's it. On another day-to-day basis, and just communicating with the patients, like you said, so much misinformation. It is having to answer questions because of something that was seen on social media or whatnot, or other venues where misinformation has been put out, whether it's about vaccines in general, whether it's about the COVID vaccine, whether it's about diseases that really were eliminated, such as measles, if we step to present day, now answering questions about that. And, do I need the vaccine? Can I just take vitamin A? Well, we know that the vaccine for measles, mumps, rubella protects very well against the disease and the complications of that. We know that vitamin A, there is no reliable evidence that something like that does help. So it's just having to go back, answer those misinformation questions. Many of them from my patients are coming from very just true questions of just wanting to know and understand, because there is so much misinformation, and it is a constant battle to just ask people to trust us, trust our public health workers, trust our physicians. I don't think many people second guess their plumber when their plumber comes over and says they have a problem because there's a leak here. Or their mechanic when something is wrong with their car, or their lawyer. But for some reason, the most important thing in people's lives, your health, your family, and your loved one's health, we get questions all the time. And it's okay to ask those questions. We have legitimate answers. And sometimes a legitimate answer is, I don't know. But for a lot of things, we have legitimate answers. And so it's just dealing with those questions, answering them on a truthful basis to enlighten those people, and then hopefully they can spread the word. And again, furthermore, spread trust in public health, in medicine again.
Well, and I think your point about vaccination and the measles outbreak is a great one, because recently I think it was blamed on, people have poor health and that's why they got the measles. And excuse me, but you see, only the ones who are unvaccinated got it, whether they had poor health or not. It's the fact that they were unvaccinated, and we've taken a disease that was eliminated in the United States, and we've turned it back into something that people have to be worried about because we don't have enough of a vaccination rate. And that gets back to that politicization, whatever the right word, when we politicize medicine too much. And we start believing in internet truths or rumors and innuendo. And to your point, lack of trust. It's like, well, okay. People said we were lining our pockets with money because we were in the back of the pocket of the drug company. Like, oh, that's just so offensive to me. I haven't taken a drug company dollar in decades. Number one. Number two, if we sit back and look at it, hospitals make a lot more money when you're critically ill. I mean, you want to fill us with critically ill patients? Well, our bottom line looks a lot better. The reality is, if we do healthcare prevention, if fewer people come in, that doesn't necessarily make us more financially successful. But it's the right thing to do for patients. Like I say, I don't give a drug company talk. I haven't had it. I just don't do that now. And I haven't for over 25 years. And so when people come up and they say, well, you did this just, man, that was tough because we know it wasn't true.
Absolutely. I'm friends with a lot of the public health directors across the region, and historically they were a trusted source and could share the information. And again, because of a lot of the politics, people weren't trusting the messages they were given, even though they were providing the best information we had at the time. So that was really challenging, and most of those individuals have since retired. It was a very stressful time for them to go through. I can remember sitting at a local public health meeting, giving information about what was happening in the hospitals and providing that view. And there were citizens in the room that accused the board of killing a family member because they refused to endorse some of the alternative medications that were available. And you killed this grandchild's granddad because you wouldn't endorse giving him that medication. And it was really unfortunate that people weren't following the science and weren't trusting our normal sources.
And we were there to do it. We were just trying to tell the truth because, goodness, we don't want to hurt anybody. So Hawk, telehealth was a silver lining. Before that, I remember we had these clinic appointments and we see, I don't remember the number as well, whatever the number, well over 1,000 patients a day here. I think it's like 3,000 patients a day. And when you have to convert those almost overnight to telehealth, we didn't have all the infrastructure, so we had to invent this infrastructure, and we did that over a period of days and hours. It was remarkable, but clearly that was a major silver lining.
It was. We were able to see patients even locally who couldn't come in because our clinics were closed, or maybe they couldn't get transportation because they are reliant on third-party transportation as well. So we were able to see and keep them followed up and give them good access to care over the internet, basically.
Yeah, it is really remarkable. Unfortunately, we are still able to do that today. Mayor Hagar, we were here on this program trying to get the word out to the community. What do you think the most effective ways were for us to share that information, and especially when that information kept changing so quickly?
Sure. I'll go back to what I referenced earlier. The MARC Multi-Agency Coordination Group was a group of the local public health, the hospitals, and others coming together and sharing what we knew at the time, sharing that with the elected officials, and trying to get the information out. But I would really point back to this show. You brought the CMOs from all of the local hospitals together. And, again, I think the focus on what we were trying to do was, we knew we couldn't stop the spread of the disease. We were trying to limit it enough that the hospitals would never become overwhelmed and couldn't provide good quality patient care. And that almost failed late 2021, early 2022. Hospitals were, we were down to a few ICU beds across the region. But you were putting the CMOs, the people who were working with the people on the front lines every day and seeing the spread of the disease. And you guys really became that trusted voice. You're out there in your white coats, and people looked to that group and under your guidance to share that information. Yeah. And I think that was invaluable. And for the Healthcare Coalition, we're really still trying to figure out how to bring that group together with us to be that ongoing voice. How do we continue to share that message? And
we should do that. We can do that. We did it before. We can do it now.
Absolutely.
So let's work on that one, because it is important. And from our standpoint, it was just a team of people. It wasn't me or Hawk. It was a whole group of folks that were trying to get everybody together and have an honest conversation, share resources, share knowledge. You learn from everybody. And I think that at the end of the day, if you just sit back and look, COVID was, everybody was busy with COVID. It was hitting everything and everywhere, and we were all in that crisis together. And the only way to approach a crisis like that is to think how we can help each other. If you think about it any other way, then I think you're thinking wrong. And we had to think right.
I think all of our hospitals, we're all competitors every day, right? We're all fighting every day for that individual patient.
I don't like your ad, you don't like that ad, right. I like my, we go back and forth all the time.
But, in this event, and we always say in the emergency management side of it, it's not about competition, it's about co-opetition.
Yes.
If we don't cooperate together, we'll compete every day for that individual patient, but when the chips are down, if we're not working together, we're not working for our community and for all of our patients. And so it's that information sharing and it's that networking that's invaluable. And this group proved that day in, day out when you would have everyone together. And these are the CMOs from the biggest hospitals in the area that were all cooperatively working.
Stormont, everybody, we were all right there doing it. And at the end of the day, I think one of the things you have to remember is our enemy wasn't each other. Our enemy was the virus. And so we had to try to defeat that common enemy. And I think, we may have said a few times, and we probably ought to just remind everybody that the rules of infection prevention and control keep you safe up into this moment and every day going forward.
I think that's still true. That is one of the best lessons that you can do. And we're asked this all the time. What are the important things? Especially now, so we're out of the pandemic, but we still have plenty of other infections. We have respiratory viruses, respiratory viral season, things like that. Continuing to do those things, understand what kind of situation you are going into, whether it's a group gathering. What are your risks for infection? Do frequent, adequate hand hygiene and try to avoid putting your hands in your eyes, your nose, your mouth. Those things are going to keep you safe from even the regular infections, the common cough and cold viruses, influenza, and even to a greater extent COVID, as opposed to something like measles, as we were just talking about, which was truly airborne and can remain in the air for 2 hours. But those things will keep you healthy.
All right, well, the Pew Research Center polled Americans on their thoughts on the pandemic. 75% of people say they were impacted. 6% said they aren't recovered some 5 years later. 25% say they were not impacted. I don't know how people weren't impacted by COVID at some level.
Yeah,
but okay, we also know less than half of Americans planned to get an updated vaccine last fall. Hawk, in your opinion, how much should we be concerned still about COVID and where people think?
I think we need to. I think as medical professionals, we have to understand the science. We've gone to that. The science says that there are still consequences of getting COVID, of getting SARS-CoV-2 infection. Whether it's long COVID, so persistent symptoms for 3 months or greater, that affect your quality of life, that may affect your ability to work, things of that nature. We know that there is still risk for going to the hospital, for dying, especially if you are high risk, if you have immune suppression, if you have other medical problems. So we do understand about that. So it is vitally important to continue to give those true messages, as well as continue to endorse and promote the vaccine. And we have seen some interim data and analysis that did show that the most updated vaccine did help reduce people's risk of hospitalization and severe cases by 30 to 40% at any one particular time. So those things can do it. And we know that when you can be well as an individual, it's better off as a family. You're not missing work. Your kids are able to go to school. That is very impactful. We know that as a community and production and all of those things, safer, healthier communities can have overall better success in getting through the day-to-day issues.
You know, we had up to 40 and 50 patients a day here with influenza this year.
Yeah.
That's a bad year, folks, and unfortunately there were a lot of deaths in Kansas this year from influenza. So the Pew survey also asked if Americans felt the country was prepared for the next health emergency. 16% said we would do worse. 43% said we would do about the same, but 40% felt the U.S. would do better facing the next pandemic. Do you think that's true?
You know, I don't think so. I think we've made a lot of assumptions coming out of it, and you know, I think we're putting restraints on elected officials, public health officials, to be able to implement what they believe is best at the time of the emergency. And again, we're politicizing being able to make healthcare decisions where there's no room for that. You know, student of history, I look back at like the 1918 swine pandemic. And we didn't learn from that.
Either, no.
We repeated the same errors. You know, I worked here in 2014 when we were facing Ebola, and you know, we did a lot of preparedness in 2014, 2015 for Ebola. And my saying at that time was, if it's wet and it's not yours, don't touch it. You're not going to get Ebola. And I was ready for that viral respiratory disease that could be spread like we were seeing with COVID, and yet COVID wasn't even probably the nastiest of what we're going to face somewhere down the road. You know, we're looking at different versions of H5N1, and you know, who knows what the next novel one will be. And are we going to be willing to do masks and social distancing? You know, I think stay-at-home orders are going to be really challenging. So you know, we have to take the lessons we learned and figure out how do we still make those best decisions and protect the public's health. And it's going to be challenging.
I could not agree more. And I think the thing that I would say, the reason I don't think we are as prepared is because misinformation has become such a powerful force, and people aren't sure who to listen to. And I think that lack makes us vulnerable. In addition, the anger against public health, against people having been told, hey, this is what you need to do to be safe, has made folks so resistant at listening that they don't want to hear it. And also, we've defunded public health worse. And it's like, well, guys, you do understand public health just kept us pretty safe. We did it a lot better in most countries, and that's really because of our public health efforts. And yet people, they want to believe the misinformation because I think it fits a certain worldview as opposed to the truth that we were trying to deal with and to tell people about. Okay, we are here to answer your questions. Send them into the links here on the screen, YouTube, Facebook, or email themedicalnewsnetwork.com. Give us a rundown of our current inpatient numbers for respiratory virals.
Yeah, so I think there is good news. We did have a peak of respiratory illnesses in, I think, December, January, and then there was a second peak now, and as you can see on that graph there. This is the last week of data. This was what we had from last Friday. That was published on Monday for our health system, for our hospital. And as you can see, 2 or 3 weeks ago, that large blue line, that was influenza admissions, is just as you said, Steve, over 45 cases at one time. The last few weeks, though, it has trailed off for influenza. And we can see there in the green and orange lines, RSV and COVID remain low for now as well. I think as we continue to move on, we will continue to see lower and zero influenza admissions. We may still see a couple RSV because we do have vulnerable populations, especially with our immunosuppressed patients. But I think overall, COVID will stay low, but I wouldn't be surprised if in the next 2 to 3 months we will see a rise in COVID admissions and circulation around our communities and around our nation. COVID is more of a seasonal infection, but it's any season that it wants to be. And I anticipate moving forward for the near future, we'll at least see maybe 2 to 3 cycles a year.
Yeah, I think that that's certainly what I've been hearing as well. And I get concerned, though, that people become so immune or they don't want to hear some of this information, and so they stop listening. And then when we do say, hey, it's a concern or it's a crisis or whatever, they won't do as good a job about responding. So that'll be a lot of work. A final question. We've been hearing a lot about measles. Who needs a booster?
Yeah, so the best evidence that we have, and the CDC recommendation, is that if you have received 2 doses of MMR or measles vaccine, you are considered immune, even if that was 2, 3, 4 decades ago. If you were born before 1957, you are considered naturally immune. There is a little bit of gray area in between there from basically 67 up through the late 70s. So I think, if you can find your vaccine record, that will be good. If not, consult with your physician. You can always check antibody titers to measles and go on from there. In the last case scenario, you are always okay to get another measles vaccine. It is a great track record, being proven to be safe and very effective. But those are the main things. The basic messaging is that if you have received 2 doses of MMR, you are considered immune. If there are other questions, please try to ask your medical teams or consult with your physician.
So at 65, I'm a 65-year-old guy here, and I had my MMR when I was a child.
Yeah.
I probably need to get a booster if I haven't ever had it.
If you don't have your vaccine records, you can check measles titers, and if those are low, you can certainly get another booster. Again, if you're unsure and there is a question, it's safe to get another vaccine.
Yeah, I think that's the key. It is always safe to get that other vaccine. Okay, we know many of you have questions. Let's head to Studio B with Alexis.
We have a couple comments and a couple questions. Lynn writes, thank you for your contribution. And then Vera McLeod writes, I appreciate the calmness and saneness this program gave us during the last 5 years, especially through COVID. And P.S., we're depending on the crew to carry us through the next 4 years, so don't go anywhere.
The next 4 years, all right.
Jeremy
we always said we're not going to get into politics. We don't veer into politics. We try to stay in our healthcare lane, and we'll continue to do that. We'll stay in our healthcare lane, and we'll leave the politics to our very, very strong elected officials like Mayor Hager. Thank you for being here, and thank you for your service.
Jeremy writes, a global pandemic was such a theoretical, that's ancient history, until we all experienced it firsthand. What was something you feel like you learned on the medicine front you don't think you could have learned without experiencing it directly? That's a broad question.
Great question. That is a fantastic question. So I have to think about it. That way I can pick on Hawkeye first.
Yeah. Well, I would say that number one, the thing I learned on the medical front is messaging. How do we message? Yeah. We always talked about vaccines, even things like MMR, chickenpox. Get your vaccine, you'll be protected. Okay, so it didn't go any farther than that because everybody had vaccine coverage. We didn't have any spread in the communities of those diseases. And now we have COVID and we have a new vaccine, and the messaging is get your vaccine, you'll stop infection, you'll stop the disease, and then there are what they used to call breakthrough infections. But we need to change our messaging. So the vaccines are not to help protect from infection, because when your body sees that virus or you inhale that virus, you have infection. What the vaccines do very well is protect against disease and the severe complications of disease. And we needed to change our messaging. I've certainly learned that. That is probably the biggest thing that I've learned.
What have you learned the most?
I couldn't agree more with the communications and the relationships that we built. So figuring out we can't do it alone, and we have to work together to protect the community's health overall, and doing that every day. I think we'll take that into the next. My job has always been preparing for the what's next. And we knew it was an eventuality. It wasn't if it's going to happen, it's when it's going to happen. 2009, we were looking at H1N1. 2014, 15, we were looking at Ebola. And then, COVID wasn't on my bingo card, but there it was. But it was a great lesson for us, and hopefully we can take those lessons learned and make it better next time.
I think I would have said messaging too, because we have to work so hard at being honest and open and thoughtful. I think I learned more about the strength of our medical community than I ever have, because of how people did come together from all of our institutions and talk about best practices. That's how I got to know Raghu Adiga, who's now the CEO of Liberty, as part of our health system. That relationship started with COVID. He is an awesome physician and an awesome person. So I think about those relationships, and I'm still like, Peter Holt, I didn't know he was a CMO then over at St. Luke's, and he was great to work. I mean, we just had so many great people to work with, and that I think that was really impressive. The team at University Health was terrific. So the other thing I would just say is I learned a lot about science. And you would think, okay, you practice in an academic medical center that you don't have, but actually, I was blown away by how fast we could go from a brand new virus to not only the vaccine, but before we had the vaccine, the antibody therapies that we used to help blunt the effect of the COVID virus and the most critically ill. That was remarkable. We turned that stuff around really fast, and we had never, ever been able to do that. You look at HIV therapy, that took 15 to 20 years to develop. This took us like less than a year to develop. Had we been like the same state of science we had with HIV, I think this would have been a lot worse.
And I would like to piggyback, because I was thinking about that too. So it is about the science and the resources. We know now that we can, and when I say we, collectively as a country or a scientific or medical community, when we have the resources, we can do this. Even though the technology was 20 years old, the development of the vaccine until it was put into arms was about 10 months, the shortest time that it had ever taken for a vaccine to be developed and approved, because there were those resources behind it, mostly those financial resources. But you also had the backing of everybody who was holding power at the time with our administrations and administrations around the world wanting this to get done as a collective. So when the resources are there, we can overcome these things. We can see fairly rapid results.
All right, Alexis.
Gene Reardon, we have one last question. Gene wants to know, with everyone traveling and flying for spring break, he's still reading and hearing about people getting COVID. How serious is this most current strain?
Yeah, that's good. So I think we really have seen since the initial variant or the initial virus is that the disease process that it causes is really the same. Now with Delta, there might have been a little bit of more severity from person to person, but in general, the disease process that this virus causes from variant to variant has really been the same, and that's what we've seen now. Currently, the most recent variants have been from the Omicron lineage. They continue to cause the same disease, no more severe, no less severe. But it is important to understand that we do have immunity. We have vaccine-induced immunity as well as infection-induced immunity. Sometimes we can hear that it is immune evasive. This is because of the antibodies that are directed towards spike may not be as optimal as they could be, but we still have our T cells. Our T cell immunity is really what helps provide the protection from severe disease. So right now there really is no difference from the variants and the disease they causes. I don't expect that to happen anytime soon, but we need to keep doing the surveillance and the investigation to make sure that holds true.
Yeah, the only thing I would just add to that is long COVID is still real, and
Yes,
we're going to have a whole program devoted to long COVID
for sure.
upcoming. Hey, this has been a really great discussion. I'm really grateful for all of our guests being here. I always love sharing this point of view with Hawkeye. That's the best. I really want to say thanks to our mayor for being here. Stephen Hager, you've done such great work and done great work with Mark and at University Health, so thank you so much for the great work. Let's hear final thoughts before we go. Mayor Hager.
Thank you for the opportunity. 5 years, sometimes it feels like it's been 15 years, sometimes it feels like it's been a year. It was so impactful, and I really appreciate, again, the good work that you put together with our CMOs, and you were that trusted source. I have no doubt there's something coming next.
Yeah.
We have other things that are going to face us other than diseases. We have World Cup, which is going to bring 650,000 people to our community in a year, and we're going to have to work together to make that successful. So the better we can create our relationships, the better we're going to have health care in our communities.
Well, thank you. And
thank you.
We depend on Mark because you guys organized a ton of stuff for us, and that was great as we were working through that. So thank you.
Yeah. I would say stay up to date with your vaccines, all of them. That is going to help protect you against the severe cases of the disease. And just like you said, I think we can't emphasize enough, the rules of infection prevention go with you wherever you are. So the first thing is understanding what kind of situation you're going into. Are you going into an airport terminal? Eventually, are you going to end up on a beach? Are you going to end up in a ski lodge? What are those situations? How easily can the virus be spread from one person to another? Most importantly, you can always wear a mask. That will be always up to you. It's okay to wear a mask. If you feel more comfortable to do that, wearing a mask will help prevent you from getting infected, even if those around you are not wearing a mask. And most importantly, and we can't stress this enough, good, adequate, frequent hand hygiene with either soap and water or alcohol-based hand sanitizers, and avoid putting your hands in your eyes, your nose, your mouth. Those are going to be the best things to protect you from getting infected with most of these viruses that we're talking about right now.
Well, it wouldn't be an anniversary episode unless I was able to reference one of my favorite Star Trek quotes, live long and prosper. But how do you do that? How do you do that? Can you really do that when you try to spread disinformation? Does that help people live longer? When you speak with anger without listening, does that help you prosper and live better? I think the answer for us is to live long and prosper means we have to stop, listen, and learn. Because out there playing are the three strands we've talked about being woven together all the time. Faith, hope, and science. Faith in each other. We should have faith in each other, but we better listen. Hope. Because that belief that together we can do things when we unite and work in the same direction allows us to keep a community safe, a hospital safe, our children safe, our families safe. And science. Because we're going to science, you're not motivated necessarily by money. You really want to try and uncover new ideas that will help benefit people writ large. Faith, hope, and science. But you have to want to live long and prosper, which means you got to listen, you got to trust, you got to unite, you got to come together, you got to say it in a calm, rational way. And maybe have a little bit of a sense of humor about just how nerdy you are. You do that, I think you can do anything. Thanks again to all of our guests. Thanks to our audience. Remember, faith, hope, and science. Live long and prosper.
You know what they say, friends who climb mountains together get bypasses together. Wait, nobody says that, except the guys you're about to meet. I'm Alexis Del Cid on the next All Things Heart. Two college buddies suffering the same medical scare under very similar circumstances, and the doctor who saved both of them, Thursday at 8 a.m.
Subscribe to our morning medical update and open mics with Dr. Stites podcast. Now everywhere podcasts are available.